Welcome to Interactive Health. Here's to your health in 2019. Interactive Health is a health management tool. You will now have the opportunity to manage your health in a single place. Interactive Health provides all of the tools and resources to be successful in your wellness journey. You will learn how to manage and or improve upon your current health. Also, Lindenwood is here on site to guide you through your journey to success. Many organizations and businesses do not have an on-site wellness resource center. Here at Lindenwood, we not only have the Lindenwood team, we also have the School of Health Sciences and the Athletic Training Performance Program to help guide us through our success. Health awareness. Interactive Health was implemented so that we're all aware of our health and know our numbers. Our medical insurance plan is self-funded. If you haven't sat through orientation recently, then you haven't heard the spiel on self-funding and insurance. Basically, Lindenwood assumes all of the financial risk for all of the claims that are generated throughout the year. We are looking to prevent catastrophic claims. Somebody who doesn't know their numbers or hasn't been to the doctor may not know that they're on the verge of becoming diabetic. An untreated diabetic could blow up into hundreds of thousands of dollars worth of claims. Cost control, copays, deductibles, and premiums are all part of how self-funding works. If I am in an accident and I generate $500,000 in claims, then we are all contributing to that, which will inevitably make our copays, deductibles, and premiums go up the next year. The data. Lindenwood University employees generated $8.3 million in claims in 2018. That includes just the people who are on the plan who work here and their dependents. The plan ran at roughly 101% of budget in 2018. 61% of these claims were generated by just 46 people. That's about $4.3 million. It doesn't take very many people to generate these kinds of dollars. Drugs alone generated $2 million in claims for 2018. We are a heavily medicated group, and we're looking forward to seeing more smiles on faces as we walk through the hallway. Fees accounted for $1.1 million in 2018. This includes any of the fees that we have to pay our administrators, as well as stop-loss insurance. Stop-loss insurance is insurance against our insurance. Anybody who generates claims over $125,000 in a single year, we're reimbursed for. However, when we have a rough year like we did last year, those fees go up, and we will be paying more than $1.1 million in fees this year. The cost per employee per month in 2018 was 11% higher than it was in 2017. All of these things were taken into account when considering what to do for the 2019 plan year. I doubt very much that you would be happy with a 20% increase in your premiums, which is why we implemented Interactive Health. As you can see, these are the ways that Interactive Health can change. Prevention, early detection, and management accounted for 11% of those claims. In other words, 11% of that $8.3 million, or roughly $1 million, could have been prevented from early detection. These are a few of the different risk factors that were found that we are able to share with you. Finally, we want to encourage you and to be on the lookout for Lindenwood challenges. February is Heart Health Month. March will be March Abness, where we'll have an ab challenge. April, Let's Get Moving, will be a nice walking challenge, provided that the weather is nice. A few of the resources here on campus that we'd like to remind you about. Real Appeal, that is the free 52-week weight loss program. However, I want to encourage you to use it. It is more than just a weight loss program. They do provide a great amount of resources for you to use. They send you really fun kits along the way to keep you motivated for your wellness goals. RX and Go is a free generic maintenance medication program. This means that you can get 90 days of your generic maintenance medication by mail free of charge. Even at $12 a piece for a generic maintenance medication, that's about $130 a year that you could spend on anything else. So why not choose RX and Go? Interactive Health, as you will see, does have a great deal of resources available on their dashboard. We do host Power Hour on the St. Charles campus every Tuesday and Thursday from 11 a.m. to noon. And of course, the Lindenwood team. Mariah Gove and Whitley Huxhold are the glue that holds it together. Welcome to the Lindenwood program overview for the January 2019 campaign. To give you a little bit of information about your personal health evaluation report, this should have been mailed to your home address that is listed in Workday. Need a new copy? No problem. You can simply log in online to myinteractivehealth.com to view your results. If you screened on campus or during the fall, you will have already created a user account with an ID and a password. If you've forgotten your password, it is very simple to just click create a new password. If you are new to My Interactive Health, then you will need to use the sponsor code listed here. The 5 controllable health factors that are used to calculate your personal health score are blood pressure, tobacco use, triglycerides, LDL cholesterol, and hemoglobin A1C. Your risk categories are low, moderate, and high. To give you an example, the low range is -20 to 0. A -20 is the best score that you can get. Your goal will be to stay in between the -20 to 0 range for 2019 in order to maintain your wellness incentive rate for 2020. If you scored in the moderate range, which was a score between 1 to 25, your goal will be to move to the low range, between a 0 and a -20. If you scored in the high range, this is anywhere from a score of 26 and above. Your goal is to improve by 60% by November of 2019. An example is a score of 30 would need to reduce by 60%, which would be a score of 12. If you had a score of 75, your goal would be to move to a score of 30. I can tell you that it is very simple and easy. You just have to be motivated to reduce those scores. Simple changes like seeing your doctor, get certain medications, or certain small lifestyle factors can all contribute into the reduction of your score. Lindenwood's benchmark group for change in health scores to show you just how easy it is. Our benchmark group was other universities within Interactive Health who have similar demographic data. That means age and gender. 89% stayed at low risk, 12% moved to moderate or high risk. Moderate risk, 39% moved from moderate risk to low risk. 40% stayed within the moderate risk range, and statistically 20% moved from the moderate to high risk. Those who were in the high risk group, 63% stayed in the high risk group. However, 37% moved from the high to moderate or low risk. 37% may not seem like a lot, but that is very significant. That's hundreds of thousands of dollars in potential savings from a catastrophic claim. Lindenwood University's 2018 scorecard, 78% participation. That means 556 employees participated in the wellness screening for 2019. Our aggregate health score was a -0.9. This is very good. This means that most of us were at a low risk. 45% of the population identified with a newly discovered condition. These conditions include things like cholesterol, metabolic syndrome, and or liver conditions. Metabolic syndrome, in case you're unfamiliar, are individuals who identify with comorbidities. 22 participants identified with critical risk factors. However, of those 22 participants, 86% accepted a phone call. 173 participants identified with a moderate to high risk factors, and 59% accepted Interactive Health's phone call. This is very good. The 2019 Lindenwood Participation Plan, your goal for 2019 is to attain 700 points throughout the year. We will show you in the Interactive Health Dashboard how you earn these points and how you track your points. You will have to either maintain or improve your health score by the time we screen again in early October of 2019 in order to maintain the wellness incentive rate for 2020. You will also have to actively participate in the Lindenwood program. So you cannot simply just have a score of -20, maintain your score of -20, and receive your incentive for 2020. You will also have to actively participate in the wellness initiative. Things like the treasure hunt quiz, this is worth 25 points. You simply answer a series of questions that help you navigate around the site. You can actually take this as many times as you need to in order to get a perfect score and earn your 25 points. Completing a preventative exam. You can simply go to your doctor for an annual screening. These can be things like a skin cancer screening, a women's wellness exam, a preventive exam by your doctor. Those are all things that can qualify. However, you can only get credit for one of those per campaign year. We do want you to go get those preventive exams. However, we also want you to actively participate in the program, which is why we only give you credit for one. Have Interactive Health share your results with your physician. This you will not actually be able to do until October when you do your screening again. But as soon as you do, you simply enter your doctor's information into the dashboard, and within an hour, that information is faxed to all of the doctors that you have listed. This is a very easy 50 points. Completing the health evaluation, that is the online assessment about lifestyle risk factors. That alone is worth 200 points. Achieving the personal health goal, this is worth 400 points. So you can see right there that you already have 600 points. If you complete the preventive exam and have Interactive Health share your results with the physician, then you have earned your 700 points to maintain your wellness participation rate for 2020. Completing a Lindenwood activity, there's 5 per campaign. These are worth 25 points each for a total of 125 points. Once you've logged in to your Interactive Health account, you will be brought to your individualized Interactive Health dashboard. Front and center, you will see your personal health score. Your goal is to be at a 0 or lower. Depending on how you scored, your goal will be different. For example, if you scored at a 25 or higher, your goal will be to drop that score by 60%. Down below, you will see the different aspects of your health. Certain things like diabetic factors, blood, emotional health. It'll tell you if you're at risk. This is based on the online health assessment that you took. Please be advised that your personal health score is solely based on the lab work that was collected. The rest of this is for your information. Next, as you move down the page, you will see your screening results. You can view your lab results, or you can view your Interactive Health report. This would have come to you in the mail from Interactive Health. If it did not, you can get that here. So to view your lab results, you'll simply click View Lab Results. It'll bring you into here to all of the different panels that were pulled. If you have one of the factors that are maybe in the red range, you don't necessarily understand what that means, you can simply click Learn More, and it'll bring you to a full explanation of what that is, why it is done, and how to prepare. Next, you can also manage your health and fitness trackers. You can simply sync your device to Interactive Health. Now, you don't have to do this, but it's just something nice to help keep track of everything that you're doing. You can also choose to chat with a health coach. By simply clicking on Chat with a Health Coach, you will be linked to a coach who will be provided your information who can best assist you. Next, the Take Action button. This is where you will be tracking all of your points throughout the year. If you simply click All Activities, it'll bring you down to Lindenwood's personalized activity list. Complete a health evaluation. We just did that in the fall. We will have to screen again this coming October, and that's where those 200 points will automatically be populated as soon as you take that screening. You will also be responsible for either maintaining or achieving your personal health goal in order to maintain the wellness incentive rate for 2020. Once you do that and your lab results are in and they're calculated, you will receive the 400 points. If you do not meet your goal, then you will not receive those 400 points. Other ways that you can receive points, because you do have a goal of 700 points for the year, complete a preventative exam. This is extremely simple. You go to your doctor. You cannot do it the day of. So let's just say we went to the doctor yesterday, type of exam. You would type in what type of exam it was, the provider, agree, and finish. And then your points are automatically calculated. You can only get credit for one preventative exam a year. Have Interactive Health share your results with your physician. This is an easy 25 points. You can only do this after we have screened this coming fall. All you do is click on it. My doctor's information is already in here. I would just send my lab results, but if you need to add a doctor, you would type in the full name, phone number, fax number, save, and then it would send to your doctor within an hour. Complete a Lindenwood activity. Every month, Lindenwood will be hosting a different challenge. Challenges and activities are the same thing. We're already pre-programmed through April of 2019. For the Heart Health Month Challenge, you will need to participate at the end of the challenge. Once you've turned in your calendar to Mariah, she will provide you with the Heart Health Month promo code. You enter that in, click agree, finish, and your points will automatically generate. Complete a treasure hunt quiz. This is simply a series of questions that get you acclimated with the website. You can take it as many times as you need to. It's an easy 25 points. Complete an online workshop. This is another way to earn 25 points. You simply click complete an online workshop and it will take you to the workshops that are available for you to choose from and complete. Back to your dashboard, if you scroll down to the bottom of the page, you will see items that are recommended for you based on your health assessment and biometric screening. Things like high cholesterol, work directly with your own health coach, support for whole health, anything that you can think of. There's quite a few of them, and we encourage you to utilize those resources.